What is going on? DeLaney back. We got another listener question, and I like this one because on the surface it's worrisome, but I think the answer is much more reassuring. So let's hit this one.
Hey DeLaney, my mom sent me this article that she read that claims that there are a whole bunch of things that can increase her risk of dementia. Do you think this is real? How should I respond? Thanks so much.
It sounds like we're related. And what I've noticed is that once my parents retired, the volume of, hey, I saw this thing that's loosely medical that showed up in my email box went up significantly. So I get you that we get these emails asking, should I be worried about this? So this paper by Manuelo et al. Was picked up by the lay press. I got sent a version of this through the Daily Mail. And it's an interesting study where the headline is shocking. And the headline was essentially, these things will increase your risk of dementia. But the devil's in the details, and I'll tell you that the devil is very much in these details. So it's an interesting study. It was done in the United Kingdom. They looked at 40,000 patients, everybody's over 45 years old. What they did is they looked at a bunch of brain scans, and they were looking for vulnerable areas of the brain, and they called it the last in, first out parts of the brain. And essentially, these are parts of the brain that develop later on. So as we get through adolescence into kind of like late teen years, these start to form. So they're the last in to develop, but they're the first out. So as we age, these are the areas that are really sensitive to aging. And the theory is that these LIFO, L-I-F-O areas have some association with dementia. If you start to lose function in these areas, maybe your risk of getting dementia goes up. These are vulnerable areas that we don't know exactly how this plays out long-term. So what they did is they looked at all these brain scans, looked at these vulnerable areas of the brain, and then did a bunch of surveys with the patients and tried to identify risk factors for showing signs of change in these vulnerable areas. And they looked at 161 different risk factors. They did some math that is mind-boggling, totally wacky, hard to figure out, but essentially they found 3 risk factors that seemed to cause increased rates of atrophy in these vulnerable areas. And that was diabetes, air pollution, and alcohol use. And what they said is that when they controlled for a bunch of other stuff, patients who had diabetes, patients who were exposed to high levels of air pollution, and patients who used alcohol showed signs of accelerated aging in these vulnerable areas. So what do we do with this? So the authors conclude that because we see signs of aging in these areas, these vulnerable areas, that these things are risk factors for dementia. That if you do these things, your risk of dementia will be higher. And they suggest, although they don't explicitly say it, if you avoid these things, your risk of dementia will go down. Is this actually the right conclusion? I would say, I don't think this is the right conclusion. So I want to be clear. If you have diabetes, you should get that treated. If you are exposed to lots of air pollution, good luck, but I think try to not be around air pollution if you can. And if you use alcohol heavily, I would say that that in general is not a positive thing for most folks, or really for anybody. So sure, kind of rein that in. Those are just general good kind of life advice tips that I could come up with. But I think the press has connected dots here that even these authors aren't connecting. So basically what this study says is that we see higher rates of brain change in patients who are diabetic, exposed to pollution, or who use alcohol. What the study doesn't say is that we actually see higher rates of dementia in these patients. It makes sense to say if the vulnerable areas of our brain are doing worse, maybe our risk of getting dementia is higher. But the study doesn't connect those dots. It's specifically just saying your scans may look a little different, but it doesn't tell us how the patients actually do. So my takeaway, this is a great way to get people to read your newspaper, to say, avoid these 3 things, your risk of dementia goes down. We should avoid those 3 things because in general, those are not positive things for our health. Whether that decreases our risk of dementia remains to be seen. I struggle with this in my family, this disconnect of what does the study say versus what does the press tell us. So I appreciate the voicemail. Good luck trying to navigate this with your family, but for now, do things that are generally healthy. That probably will decrease your risk of dementia as much as possible. And as the science continues to develop, I think we'll get more granular detail about, are there specific things we can do or shouldn't do when it comes to really dialing up or down that risk of dementia?
This is Hippo Education.